Today I'm going to talk about a condition that I've been suffering with for a number of years. It's called trigeminal neuralgia. Trigeminal neuralgia mostly affects the over 50s, and I'm over 50. So I'm going to explain what trigeminal neuralgia is and how I manage my problem. Let's check it out. So the official description of trigeminal neuralgia is the sudden, severe, brief stabbing pain occurring in attacks lasting at most a few seconds, usually on one side of the face, and provoked by light up. But for me, it is quite different, and for everyone, it can feel quite different. In most cases, people suffer only on one side of the face, and for me, it is on my right-hand side. But exactly what is it, and what causes it, and what can you do about it? The trigeminal nerve is in the side of the face, about here, and it splits into three, hence why tri. There are three groups, one into the jaw, one into the like the cheekbone area, and one into the eye socket. The official names for these are as follows. At the top of the head and going down to the eye and to the nose is called the ophthalmic zone. In the middle, going into like the cheekbone, is the maxillary zone, and further down into the jawbone is the mandibular zone. And I get affected personally in all three areas. The exact causes of a person's problem may not be known, but the following may increase risk. That is pressure from blood vessels in the head, pressure from a tumour or a cyst, injury to the trigeminal nerve from head trauma, surgery or a stroke, or damage from other diseases, and the main one is multiple sclerosis. Most attacks are brought on by some kind of trigger in the face, and these can be something as simple as eating or drinking, smiling, yawning or talking, shaving or washing your face, putting makeup on, I don't put makeup on, combing your hair, wind or temperature changes, and I'll go through that in a minute, noise or lights. For me, I do cycle to and from work. It's not very far, but of course you do go into the wind, and temperature changes happen as well. For me, what happens is I get quite painful gums and teeth. I've tried all the sensitive toothpaste and I've been to see the dentist and everything like that, but they just said that it might be just old age basically. But I'm beginning to come round to the opinion, and I've got no medical proof to this. The reason why this happens is because of my trigeminal neuralgia, and the trigger is the wind and temperature changes. Like I said, that's just my opinion. I have absolutely no idea if that's true or not. So how was mine diagnosed? Well, I was getting these pains in my jaw, my eye socket and in my cheekbone. And I was getting quite concerned because they were coming more and more regular. All I did is I was in to see the doctor, and she was touching my face. Now this personally didn't trigger it for me, but for some people it can. I will say now that mine is extremely mild compared to a lot of people. I do get the pain, I can feel it now as I'm talking in my jawbone. There you go, talking, maybe setting it off, but not necessarily when I'm talking. Another thing for me that sets it off is if I drink alcohol. It can be as little as just 1 or 2 sips of wine. There is no apparent reason. I've tried to do some research, but there's no apparent reason, and it really is completely random for me. For some people, it is far more severe, and they are in constant pain. Unfortunately, there is no cure. Now, if it really is that bad, very, very debilitating, then it is possible that surgery may work. But that's really in extreme circumstances. I personally am nowhere near that stage. I just manage it and just put up with it. I've learned to live with it, and that's the best I can do. So to sum up, trigeminal neuralgia is generally caused by disruption to the trigeminal nerve. Usually the problem is a contact between a normal blood vessel, an artery or a vein, for instance, and the trigeminal nerve at the base of the brain. The contact puts pressure on the nerve and causes it to malfunction. That's briefly what trigeminal neuralgia is. I've had it for probably about 5 years now. I've learned to live with it. It's not severe for me. If you think that you might have this problem, don't take this as medical advice. Go and see your doctor and get them to check it out properly. What about exercise, I hear you ask? Does it help? Well, I have found that when I exercise, I don't get any pain very often, but that could be because I'm concentrating on the exercise itself and it takes my mind away from the trigeminal. All right, I call it trigeminal. I've got so used to it, trigeminal. Okay, but there you have it. Just very different one. Just want to explain what it is and what I suffer from. But I say it really doesn't affect my life to any great extreme. Okay, if you got some value out of this, please like, subscribe, maybe share if you know someone who may be suffering. And otherwise, I will see you again soon.